Uh, First of all, very good afternoon, everyone, and I will like to say thanks to Vishpana ma'am for what I am here today is due to her. I can say very proudly that after Dr. Asrani sir, I am with NJ since 1992 and continuously I am with that, and she has actually nurtured me, and I am in front of you due to her only. Whatever I write or whatever I present, it is her guidance every time that I can work out on that.
You are happily taking off all discount and giving it to me.
No. Please, once again, I wish that we should give her a standing ovation. Once again, please. Thank you, ma'am. Thank you for whatever you have done for all of us. Thank you. I will begin with my presentation now. This is my clinic logo. It is not actually nothing. What is more important in this is the tagline which I have written there is that life is simple. This is very important. This simple word is coming from two things. Number one, simple substance, which Dr. Kent has written very nicely. And number two, homeopathy is very simple. Very important. Life is simple, as Dr. Kent has said, and that simple substance which governs our whole body, and we have to remember that simple substance every time when we are prescribing for the patient. So keep that in mind. So this simple thing is not that much simple. When we start prescribing, it is a complicated one. So when we start giving some treatment, when we start prescribing, we start to find out a simillimum. For any case, whether it is headache, migraine, whether it is, we have to remember that it is not the migraine, it is not that what we call it as the diagnosis, whatever it is most important, but we have to think of that simple person who is in front of you. So what is the ideal way, which is the ideal approach to find out the simillimum? For headache, we are going to actually mix and match what Dr. Asrani sir has given us that idea. I am going to collage it with our approach. To arrive at the simillimum is not difficult. It is definitely difficult, but it is not impossible also. We may fail to elicit the meaningful information to understand the patient. We may fail to elicit the meaningful information. The patient is giving you information every time. Whatever words he is speaking, we have to look at that. Then to understand the patient, many of the time what do we listen just to listen to the patient. What I feel that we should listen to understand the patient. You must keep this in mind, that listen to the patient to understand him, what he is trying to speak, to appreciate what patient may be trying to communicate. He is trying to communicate something. डॉक्टर साहब आज मुझे सर दर्द हुआ, कैसे शुरू हुआ? नहीं, जरा सा मेरा झगड़ा हो गया. So even at that time, as Dr. Asrani sir has said, your mind should start thinking that exactly what must have happened. Whether that quarrel was simple quarrel, but it was very major quarrel, and whether these incidences are occurring in the patient's life frequently, then only we have to think in that whether it is a nervous headache or what, right? So differentiating between the types of headaches is difficult. As Dr. Asrani sir has said that these all types are there, most of the time they coexist, and then it is very difficult. So it is our mind. It start thinking whether to prescribe on whether we have to prescribe on XYZ medicine. Dr. Vishpana has given a very nice case of sepia, and it is the same case, and then I start prescribing sepia to the patient, or I start giving medorinum because medorinum has cured a case which was treated by Dr. Ajit Kulkarni sir, and that we just think and we give to the patient without giving much importance to the pictorial symptom or to the symptoms which are with the patient. And the main reason for this is prejudice. This is what is prejudice. We have already defined or we have already diagnosed patient aate barabar. Yes, it is nervous headache. I am going to give her ignatia. This is tension headache. I am going to give her something like staphysaria. So nothing like that. This prejudice is very dangerous. Prejudice about one approach. There are many approaches. Homeopathy is individualization. And so what happens? Every person thinks individually. According to him, he thinks that he is himself is Hanuman. And then he starts his approach. Yes, we have to give according to this approach only. That means what? One method, that I will give only single medicine, I will give polypharmacy, or I will give medicines according to the sensation, I will give according to this. Only these different methods which are there, they will try to inculcate, and then he will start his practice. And about a particular remedy, just what I told now. But Hanuman in the aphorism number 83 has very clearly said that freedom from prejudice and sound senses, attention in observing, and fidelity in tracing the picture of the disease should be there always. Never forget this aphorism number 83. When you are prescribing for the patient, no prejudice. Every patient is new to you. Every patient is perfectly a new venture for you, right? So the organ of medicine is solution for every question. I think, and I am very confident. How many of you have read Organ of Medicine from preface to the last? Please yes, there go. Very few. Only 1, 2, 3, 5. Nobody has read. This is the Gita, this is the Bible, this is the Quran of homeopathy, and we don't touch it. It is unfortunate. But every answer of your question is there in Organ of Medicine. So I request you that from today only, even you start reading one aphorism daily, it will be much more, you will increase your practice 101 times. Okay? So good history, as Pranav sir has also said, and right sequence. These are very important things for homeopathic approach when you are prescribing. Location is very important. As we know, location, sensation, modalities, concomitant, along with, this is most important, origin, duration, and progress of that particular symptom or of that particular disease. If you don't have that ODP, origin, duration, progress, you will not able to diagnose properly, whether it is acute migraine, whether it is acute headache, or what it is, or whether it is a ischemic attack. And this is most important. You will get this miasmatic dominance in each case. As sir has said that there is no cure, but I can say definitely that the cure in allopathy is not there because they don't have the miasmatic background. They don't have that miasmatic concept. If we have that miasmatic concept of psoriasis, syphilis, psychosis, and especially in cases of children where tubercular miasm is there, if you don't give anti-miasmatic drug, the cure will not be possible. So you have to find out that miasmatic dominance, and don't forget the instructions given by Dr. Hanuman from aphorism number 172 to 184, which describes one-sided medicine, one-sided diseases, right? So you have to go through this 172 to 184 for clear concept of your prescription. As sir has given, sir, I told you, we'll mix and match. Few of the medicines I will not touch, I will go further fast. This symptomatic headache, as you know, sir has told, homeopathic prescription purpose will make it symptomatic headache and idiopathic headache. Okay? We have made classification. In that, in symptomatic headache, you have got catarrhal headache, then you have got congestive headache, then you have got gastric headache, rheumatic headache, arthritic headache. In catarrhal headache, as it is attended with or it has started after a suppressed coryza. We have got medicines like Nux, Bryonia, Aconites, Sabadina. I am not going in detail of that. Congestive headache, where the congestion to the face and head is much more marked than the other patients. Gastric headache which is attended with nausea and vomiting. Rheumatic headache. See, these are the actually nomenclatures which are being used in homeopathy. They are not exactly related with the allopathic nomenclatures. Rheumatic headache, it is pains which are shifting from place to place. As in arthritis, rheumatism, it occurs. It is, that's why it may be have used. It is in old books, you can get that. Pains which are shifting from place to place, and we have to differentiate it from arthritic headache, which is very severe, boring, or sitting deep in the brain, and which is accompanied with the vomiting. So you have to differentiate that. Don't get mixed with this. Then this second type is idiopathic, which we are now interested in. It is in our homeopathy, migraine, hemicrania, nervous headache or sick headache. Like that it is been named by various authors. But there it is classified into true migraine, neuralgic headache and nervous headache. Okay. So idiopathic headache, that is true migraine, which affects one side of the head. Then it occurs more or less periodical paroxysm, generally attended with vomiting. And neuralgic headache, you will get it occurs very periodically. It also affects one side of the head. In some cases, excites vomiting, but the course of the headache never ends with one paroxysm alone. But the paroxysm generally recurs at the same hour or several days in succession. Sometimes with all the regularity of an intermittent type. So we can have that classical periodical headache. We can take that rubric when we are prescribing neuralgic headache. Nervous headaches, these are found generally in hysteric or in hypochondriac people, debilitated by excess or loss of vital fluids. It is not governed by fixed period or types like what we see in the neuralgic headache. There is periodicity. Here it breaks out into indefinite intervals and it is excited by almost any special case such as emotion, mental exertion, menses, and then it will be called as idiopathic nervous headache. Okay. Then as far as given that migraine without aura, I am just because he has explained on that, I will give you some medicines. Migraine without aura, sanguinaria, silica, spicalia, then menstrual migraine. It is very important. Most important medicine is cyclamen, meliodatus alba, lacasis, sepia. All these are better when menstruation starts. These are all aggravating before the menses. Okay. Then you have got vestibular migraine. This is very common. You will get that in populus indicus, most important remedy which is there. Then tabacum, petroleum, abdominal migraine. As sir has rightly said, it is generally found in children. For that, this is one of the medicines which we never think. That is Eupatorium perforatum. You have got Podophyllum, you have got aloe and ignatia. These are the medicines which are most important. Then retinal headache or migraine. Here you will get again cyclamen. So it is a combination, right? Then iris versicolor, meliodatus alba, sulfur, lactefluoratum, calibichromicum, picric acid, and argentum nitricum. With these, when there is eye strain and they are leading to these headaches or they are leading to this problem of migraine, then you have got very good medicines like ruta, geranium, tuberculinum, onosmodium, Epiphagus virginea. I am going to explain you one medicine and that is Epiphagus, because this is not being taught in your curriculum. This is out of curriculum. It has got headache of neurasthenic type, especially in women brought on or made by worse by unusual exertion, shopping, nervous strain. Right? Then pressive pain as if fingertips were pressing into the temples inward. So someone may think of calibichromicum, that very small spot. Compressing pain going backwards and until 4 p.m. 4 p.m. lycopodemy you start, but here it ends until 4 p.m. and with spitting of viscid saliva and nausea. So you may get confused with Merxol because there is viscid saliva or calibichromicum along with nausea like Ipecac. Okay? And this is most important, weekly sick headaches, and these headaches are preceded by hunger. So even a cup of vanilla that should actually cover, but if it is not covered with a cup of vanilla, then you have to think of the medicine of Epiphagus virginea, right? And this is the aggravating factor, worse by shopping, good for ladies, and eye strain, and better by sleep. Then cluster A, as far as described, most medicines which are useful are gelsemium, thuja, and argentum nitricum. It is said that till the time you don't get puja to the patients. In some cases of cluster headache, your cure will not be possible, or the frequency of the headaches will not be reduced unless and until you give a miasmatic. Basically, that miasmatic block we have to remove that, right? Naxomica, as usual, is wonderful medicine. Then tension headache, you have got verbascum. We don't think of verbascum, we just think verbascum in cases of ear complaints only, but it is one of the most important medicines. Due to its action over the inferior maxillary branch of the fifth pair of cranial nerves, it causes pressing and stupefying headache, which we have to keep in mind. They are worse by biting, drafts, change of temperature, and twice a day at same hour. These are most important things which we must find out. Spigelia, Communist Party, neuralgic headache, aggravation by stormy weather, as if head would burst on moving facial muscle, and it is aggravated by smoke and tobacco. I am not going in detail, but Sabadilla is very important. We just think of Sabadilla in cases of worms. Sometimes we think in cases of cough, but this is most important in cases of headache, which are caused by mental efforts, especially in school-going girls. This is one of the important things where we can think of that PQRS, no? That we can get that PQRS from that age group, right? Corrosive burning point on the top of the head with cold sweat, oversensitive to odors, with spasmodic sneezing and running nose, like sir has got slight that hoarseness of voice and everything due to some pesticide odor, persistent violent or aborting sneezing and dizziness. These are most important things. This is most important. Medication overuse headache. In practice, you must remember these medicines. Number one is Naxomica. That you all know, allopathic medication, after when there is too much of allopathic medication you have taken, then Naxomica is one of the important medicines. But what about homeopathy? Have you thought that the patient has come from 2 to 3 homeopaths, they have tried many medicines and nothing is useful? उल्टा क्या हो रहा है, वो बढ़ रहा है, डॉक्टर साहब होम्योपैथिक लिया बहुत, लेकिन मेरा फेथ है होम्योपैथी पे, इसीलिए किसी ने आपका नाम बोला और मैं आया हूँ आपके पास में. So it is our duty that if there is over medication is done, Sepia is one of the important medicine which we have to start with. Along with that, Cuprium marum. These are the two important medicines when there is too much aggravation after homeopathic medicine. Kent has also given one very important observation. Then when podophyllum is given in very high potencies to check the diarrhea, then patient gets headache. This is Kent has said. And then at such times, we have to antidote podophyllum by either giving the low power or by giving medicine like Sepia or Cuprium marum, which is more suitable then. This is another problem which is coming up nowadays. Birth control pills. If it is used more than what is required for a longer period, then the pattern of PCOD or some other problems they start. So, birth control pills, when overuse is there, pulsatilla is the choice of medicine. You have to of course go for the constitutional symptoms also if they are matching, but if you can start with that will be better. Iron, too much of iron. मेरे बच्चे को बहुत एचबी कम है तो आयरन खिलाओ आयरन. One of the important remedies is again pulsatilla, but zinc metallicum also works very nicely in these cases. Then cervicogenic, as Dr. Asrani has differentiated that, this is cervicogenic or occipital lacnanthus, one of the most important remedy which is useful for cervicogenic or cervical spondylosis. The patient is restless, excited, loquacious, right-sided neck pains and icy coldness of the bed. More important, natrum mur. Natrum mur, as it has got an emotional attachment, and that cervical spondylosis, one of the important medicines. Almost all types of headache are caused by natrum mur. I will dare to say that when you are not getting anything in that headache particularly, if you are not getting response, then give natrum mur. Where aura is there, tingling, numbness of the lips and tongue. These are, I am just going fast. When you are prescribing homeopathically, you should not forget all these things. Ask about the occurrence of pain, whether it is increasing.
So 5 minutes have.
Yeah, 5 minutes. Increasing and decreasing gradually, or it is increasing and gradually and then suddenly ceasing, suddenly disappearing and disappearing suddenly. Remember, every medicine has got its own pace and its order of succession. You have to give more importance that at what pace the medicine is working, then only you have to prescribe. Otherwise, it will be very difficult. Don't forget to ask the type of pain. What is the type of pain? These are all rubrics which we get in our repertory. If your mind is knowing, then only you will ask. Otherwise, you will not look into that matter. So, benumbing, bilious, biting, burning, blow as after a bolt as from. There are many rubrics which we can find, and accordingly the medicines are there. So, don't forget to use these rubrics. Periodic, 3 or 4 days, hours at certain hour. Then every day same hour, continue for 2 to 3 days, other days. So these are all rubrics which are actually listed under the periodicity. Okay, 10 days, 14 days, lasting for 2 or 3 days, months lasting for 6 weeks, every Sunday, 21 days, alternating with. This is also very important. You should not forget this. Alternating with various events like abdominal complaints, asthma, diarrhea, alternating sides. One side, once left side, then right side, then again left side, like that. Pain in winter, summer, autumn. And now one very interesting thing we are going to start. Guess the remedy. If you can, very good. I will give you a 5-star. Chocolate. Headache after inhaling cold air through nose. One very specific. Can you tell? Inhaling cold air through nose, headache starts. I will go fast. If someone corallium rubrum, we think of corallium rubrum only in cases of milious asthma or continuous when there are cough episodes. We think of that, but that inhaled cold air goes to the nose, then it affects the throat, and then ultimately it settles down in the chest, causing that cough. Feeling as if cold air was streaming through the skull and air passages. That is the first thing, with hot and painful eyes, deep-seated frontal headache with severe pain at the back of the eyeball. Okay. Next is this. For the students, for the headaches of students, teachers, professional men, and overworked businessmen. No. Very specific. All this it is covering. Calcarea फॉस नहीं, खाली फॉस नहीं, नक्स नहीं. It works on everyone. The medicine is picric acid. Okay. And Kane says that for headaches with great nervous weakness from grief and depressing emotions, it has been overlooked. Nobody uses it. Congestive headaches, head must be cool, works from warm room, wrapping up the head, better from rest of mind and body. That is picric acid. Next, school girls तो देख लिए, लेकिन explosive headache of school teachers with frequent urination. Can you tell this medicine? This is very important medicine which we generally don't think of at all. No gelsemium. It is explosive headache of school teachers and with frequent urination. The medicine is Tutelania leprechauns. Please remember this medicine. कोई आएगा तो उसको प्रिस्क्राइब जरूर करना. It has got dull frontal headache, eyes feel pressed, night terrors, he is sleepless. कल मुझे ये क्या पढ़ाना है मालूम नहीं है. Sleepless night, sudden wakefulness with frightful dreams, right-sided medicines, worse by noise, odor, light, and better at night by rest. Right? Guess the remedy after लंबा पंक्चर. लेडम्बा और नहीं, उससे भी ज्यादा बहुत इंपॉर्टेंट मेडिसिन है. तो भी लेडम्बा इस बराबर है, इसलिए मैं आपको एक देता हूं मैं. Yes, please come on, fast. Medicine is very simple. Hypericum. Okay. Hypericum. Frequently we don't look into it. Heavy feeling with icy cold hands, throbbing in the cortex, brain seems compressed, head feels longer, elongated to a point. These are the three things, sensations. Brain seems compressed, head feels longer, elongated to a point, and brain feels alive. Okay. And it involves the right side.
So time up.
Only 5 minutes, not more than that.
1 minute.
Here is the remedy. First, contact lens. You are using contact lenses, they are annoying. What is the medicine? Pituitary, anterior pituitary. Then, quick prescription. I will go quickly. Missing breakfast, calcaria. Delaying dinner, cactus, cistus, lycopodium, chorus after. Bryonia staphysagria. Striking head against wall ameliorate, tuberculosis. Shopping from sepia. From dancing, Ariantum nitricum. Alcoholic drinks, Naxomica, lachesis, ranunculus bulbosus, natron and agaricus. You should not forget these all 4 mark medicines. Right? Now this is the last one we'll see. Just like mercury, this medicine has got profuse salivation. Okay? Just like Naxomica has acidity and intoxication after alcohol. Just like Ipecac, it has got intense nausea and vomiting. Just like Carboways, it has got profuse sweat and prostration. Lobelia infrata. We think Lobelia infrata only in cases of asthma, but we don't think it is a combination, wonderful combination of both Nux, Ipecac, Carboways. My dear friends, why I am showing this? Because homeopathy is a learning process. Materia Medica, we start reading and then we start sleeping. So you have to make it interesting by combination of these three. So if you remember, mercury में भी profuse salivation है और किस में है? So this is how you can learn and you can make it interesting.
Thank you, sir.
Only differentiating point I will tell: faintness and constriction is epigastrium, and despite all the derangement, it has got good appetite.
Thank you, sir.
Okay, thank you.